Good morning, friends. So both the current years have joined. Shreya and Gulin are there, and I can see Ruzi and Sushant. You have already listened to this presentation last year, but maybe a kind of revision and certain things would become more clear. So I read one story about Akbar and Birbal, and as you know, there were nine Ratn in Akbar's Darbar. So Akbar asked everyone how to reliably measure the intelligence of a person. And as usual, all the nine people, they got onto their own ideas describing how to uh, measure intelligence. So they came out with various tests and various methods and all that. However, Akbar was not happy because he felt that all of them are subjective, and I need objective methods to measure intelligence. And as usual, Birbal was the last one to chip in. He said, Your Honor, just give me one day and I'll give you some very objective method. So Birbal thought about it. And when he came back to the Darbar next day, he said, Sir, use shoe size to measure intelligence. It was highly objective. Whether it is Bata or Metro or Liberty or Mochi or whatever, your size will remain 8. You measure on left foot or right foot, the size will remain same. You measure today or tomorrow or day after 1 month, the size will remain same. It was highly objective. So Akbar was very happy. He said, yes, this is the way to measure intelligence. And I think since that time, we actually got stuck to the idea of using shoe size to measure intelligence. The story idea came from William Burdick from Famous. I only translated it into Akbar and people. But the point is that in the garb of objectivity, we actually keep on ignoring many things which otherwise could be measured, albeit less objectively. If we go back to our Indian educational system, then everything was actually based on the good for the teacher. The teacher decided who came in, so there were no entrance examinations. He decided who was fit to go out, so there was no exit or NEET. He decided who needed remediation, so there were no court cases कि मेरे को तो फेल कर दिया, मेरे को तो रोक दिया, मेरे 6 महीने खराब कर दिए. And who was fit for further training. So specialization किसको देनी है, किसको नहीं देनी है, all that was guru's prerogative. And it's not that this was all that old. Even during my time when I was a student, we had the same thing actually. Teacher decided. When I joined CMC Ludhiana in '86, Dr. Sheila Singh Paul was head of pediatrics, and actually she would decide. So she would call somebody, David, I don't think you are ready for MD exam, so don't appear this time. Take 6 more months. And David would say, yes, ma'am. And then she would call Jugesh one day, although she had done only 1.5 years rather than 2 years. And she'll tell Jugesh, I think you are fit to go. So why don't you appear for exam? Yes, ma'am. So that time university was not that strict about time and all that. So all this, but the point that I'm trying to make is that the person who is with the student and who is observing the student consistently 24/7 is in a much better position to decide about the learning, the knowledge, the skills, the competence compared to a person who comes only for 15 minutes and then goes away. See, most of our external examiners, don't interact with the student for more than 30 minutes in it total. 30, 45 at the most, not beyond that. Rest of the things either the student does on their own, or there are so many students that even if they want to, they cannot. And over the years, unfortunately, subjectivity came to be associated with bias. The moment you say subjectivity, it was bias. And the moment you say objectivity, and we were actually programmed like that, that objective is the best. So whether it is entrance exam or class test or formative assessment or internal assessment, anything. And the interesting part is that all of us have actually been a product of the subjective system. We continue with subjectivity. What is objective? Your essay question is objective. Your long case is objective. No. Short case is objective. No. Field visit is objective. No. So we are doing everything subjective, but when it comes to adopting something new, we get stuck on this point. Oh, it's not so objective, so it may not be worthwhile. And even you look at the new regulations and all those things, everybody is stuck on the word objective, as if objective is synonymous with good assessment. So today, let's try to explore a little more on subjectivity, objectivity vis-a-vis the assessment, especially for competency based. And for competency based, it's all the more important because many of the components of competencies, sorry, this is an old presentation with Amritsar credit. So if you look at the competency, the components of competency, so knowledge, skills, attitudes, professionalism, ethics, reflections, everything cannot be objectively assessed. Maybe knowledge, but even that cannot be. Saiba, this carries the old label. I hope you don't mind.
Pardon, sir? Good morning, sir.
You're representing a university. You should be proud. And you remember the first presentation that we had, the changing assessment. And as we saw, the emphasis shifted from objective to expert subjective. And now almost we are all on the verge of going in for a programmatic kind of assessment. And you would also remember the first presentation that earlier the emphasis was purely on measurement with the philosophical background that if something cannot be measured, it should not be assessed. And if you cannot measure something, then either it doesn't exist or it's not important. See, even after 70 years, we are still not assessing professionalism just because of this reason, because you can't precisely measure it. So leave it out. And the assessment, just because of objectivity, actually moved from real life, the case presentation, to laboratory, OSCEs. अभी तो फिर भी थोड़ा कम हो गया है, but there was a period in between, say about 20 years ago, when it was believed as if OSCE will transform the world and assessment will change and blah blah blah. Unfortunately, nothing happened, and we also kind of understood that probably we are overrating OSCE. There's a journal called Medical Education. I hope you have heard about it and maybe read some articles. So in medical education, they have a section where they publish discussion, freehand, open discussion between two experts. So it is either email discussion or even verbal discussion, which they later transcribe and publish it out over there. In one of the articles, they published an interaction between Harden, the person who started OSCE, and Kevin Eva. He was on the other side. Now, it begins with objective structured clinical examination. And we took that objective very seriously. But after 30, 40 years of having run OSCE, we now realize that the benefits of OSCE are not related to its objectivity. They are related to its bigger sample. And interestingly, in that discussion, Eva asked Harden, when you started OSCE, what you had in mind? And it's very interesting. Harden says, I never had objectivity in mind. The person who started OSCE admits on record that he never had objectivity in mind. So, what was in your mind when you started OSCE? He didn't even say sample size. He said, I did it for direct observation. But वो distort होते होते, so from objectivity, we just forgot about direct observation. So OSCE is now a theory question put up over there or something. You don't see that. You're not interested in observation. You're just interested in objectivity. But the matter of the fact is that when it was started, OSCE was never meant to be replacing subjective assessment. It was actually to have a direct observation of the student doing something. And we tried to control everything except competence. Patient भी control कर लो, time भी control कर लो, history भी control कर लो, observer भी control कर लो, सब उसको rotate भी कर लो, so that your assessment gives you only competence and not anything else. What is called error score. So you have a true score and an error score. True score is actual knowledge base, and error score is extraneous factors. So you try to control the error score by controlling everything except competence. However, around the same time, if I say 15, 20 years ago, Jeff Norman very rightly said that a number of competencies cannot be precisely measured, but add to physician competence. And ignoring these will have serious consequences. And I think after 14 or 15 years of what he predicted, we are already facing that issue that our graduates may be okay in knowledge and may be performing procedures, but when it comes to communication, when it comes to professionalism, we are lacking a lot. And you would also remember that diagram which I had shown you, the model of competency assessment. So approximately it should be 75-25 between what is measured and what is not measured. Not measured, when I say, don't take it like this that we just ignore it. When I say not measured, that means it is not on a quantitative scale. So there is a qualitative assessment or descriptive or narrative assessment, whatever you call it. So 75-25, that is generally the proportion which most people would agree if you have to really assess the competence of a student. Simultaneously, the educational paradigm has also changed. So from earlier conceptualization of education as knowledge and qualification, we actually have moved on to competencies, key competencies, and the whole objective of doing all this is to ensure that the graduates are employable. What is the use of having a graduate if he cannot find an employment because he doesn't know the skills or doesn't know the competencies? So this transition between knowing and doing was one which was actually responsible. So when we say qualification, It is fact centered. तो आपको इतना पता है, you can answer 10 questions out of 10. You can perform so many procedures out of so many procedures. But whether you can use it or not use it, that is not really considered important. Competence, on the other hand, is actually value oriented and extends to the whole person and focuses on ability to act. So the paradigm shift from knowing to doing is what is important. Certain other things which you must keep in mind is that competency does not reside in the individual. So what it means is that you cannot label me ये competent है, ये incompetent है. It all depends on context. Like I give you that example, somebody might be highly competent in a primary health center. You send him to AIMS tertiary care, he'll be incompetent, and vice versa. Somebody who can do open heart surgery very competently at AIMS, for example, you send him to the village to manage a patient with some stroke, may not work. So it is how the individual interacts with the context. Not, it's not an innate property. No, it's not that I am born incompetent or I am born intelligent. So it all depends on what kind of context I am working with. And so we have to move from knows and knows how to does. And Avinash and Krishna, they had actually written a paper. I hope it's going to come in next issue of NMGI, where they suggested that a simple thing like moving assessment to does can actually make wonders. Can work wonders. All our assessment is only knows how. Very rarely we go to shows to. So if you move up even beyond shows, does, because shows is also in a controlled atmosphere, whereas does is in the natural atmosphere. And very interestingly, if you look at Miller's pyramid, the more you climb up, the more subjectivity comes in. It's possible to highly objectively assess knowledge, recall type of knowledge. But the moment you start assessing application of knowledge, that objectivity goes. A little bit of subjectivity creeps in. And when you look at shows, it becomes even more subjective. And when you assess does, it's almost subjective. And again, when I say subjective, please don't equate it with bias. Subjective is looking at the thing from your perspective, your lens. It's like this that one patient goes to four doctors, all four may make a different diagnosis, all four may prescribe a different medication. That does not mean one was wrong or one was right. It is only the way you look at things that makes all the difference. And also remember, validity lies in interpretation. Validity does not lie in the tool. So it's a very wrong statement to make this is a valid tool or this is a reliable tool. A tool can never be valid or reliable. If, for example, MCQ we say is a very valid and reliable test of knowledge, but suppose you give only 5 MCQs at the end of 5 years, they may be highly objective, but would they be valid? No. Would they be reliable? No. So validity and reliability actually both depend on how you use it rather than on the format of the question. So it is not OSCE or MCQ which is valid or reliable. It is the interpretation that you make from. And then formative, summative actually have their own problems. Pure formative, nobody will pay attention. You tell your students, come, I'll give you feedback today. Hardly anybody will come. You say, okay, okay, we'll go and give you only marks, only summative. There is no effect on learning. Rather, there actually, I showed you last time, there's a negative effect on learning if you are using only summative assessment rather than using it for formative purpose. And to improve performance, qualitative methods have to be. I gave you that example of your mother teaching you how to cook. When you were in the kitchen, she didn't just peep and say 4 by 10 and walked off, or 5 by 10 and walked off. She'll come, she'll taste that food, she'll tell you इसमें नमक थोड़ा कम है, मिर्ची थोड़ी ज्यादा है, घी थोड़ा कम लगाओ, इसको थोड़ा और knead करो. This qualitative information makes a lot of difference when you have to improve the quality of performance. And many years ago, almost 50 years ago, 48 or 49 years, Harrison Keller said that effort in competency-based education should not lie in the design of instructional material, but in the design of appropriate assessments. And went on to say that institutions should not commit to competency-based unless they have the means to directly assess the student's performance. So timetables, integration, SDLs, etc., 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 do not add value to competency-based education. What adds value is seeing what the student is doing, how is he doing. That is what makes all the difference. Now, there are many assumptions we work with. So, we think that multiple competencies need to be integrated. Knowledge, skill, communication, professionalism, ethics, वो सब मिला के और आपको पेशेंट से डील करना होता है. वेरी ट्रू. पर हम इसको फिर उल्टा ले लेते हैं. जोड़ने की बजाय हम इसको तोड़ना शुरू कर देते हैं कि कॉम्पिटेंसी ले लो, उसको तोड़ के उसके टुकड़े कर दो और ईच टुकड़े को आप असेस कर लो. और फिर हम कहते हैं कि जो स्टूडेंट होएगा वो जब प्रैक्टिस में जाएगा तो वो उसको वापस रीअसेंबल कर लेगा. तो अगर स्टूडेंट उसको रीअसेंबल कर सकता तो हमको कॉम्पिटेंसी बेस्ड की जरूरत ही क्या थी. जो चल रहा था बहुत अच्छा चल रहा था. Competency based education came only because we found that the student was not able to reassemble all those bits and pieces. And Lambert Schubert and Case Luton, they gave a very nice example. What they say कि if you have a bicycle, आप उसको डिसमेंटल करो, आप उसके आखिरी पेज तक उसको निकाल के आप हर चीज उसकी अलग अलग कर दो और फिर आप उसको जोड़ दो, फिर साइकिल बन जाएगी. फाइन. पर अगर वही सारा कुछ आप एक फ्रॉक के साथ में करो तो वापस फ्रॉक बना पाओगे उसको? नहीं बन पाएगा. तो कुछ चीजें बाइसिकल होती हैं, कुछ चीजें फ्रॉग होती हैं. हम हर चीज को बाइसिकल जैसे ट्रीट करेंगे तो भी प्रॉब्लम है और हर चीज को फ्रॉग जैसे ट्रीट करेंगे तब भी प्रॉब्लम. एंड इंटरेस्टिंगली आज तक ऐसा कोई एविडेंस हमारे पास नहीं है टू से दैट द स्टूडेंट इज एबल टू इंटीग्रेट ऑल द थिंग्स बैक इनटू अ मीनिंगफुल गोल. सो हम ये प्रिज्यूम करते हैं खाली कि वो कर लेगा, जब वो नॉलेज होएगी और स्किल्स होएगी तो वो मिला के कॉम्पिटेंसी बना देगा. बट इज नॉट ट्रू. So isolated assessment of knowledge, skills, attitude, communication, etc. don't constitute assessment of competence. And I gave you that example of communication last time. Telling a mother to breastfeed her baby and telling a mother to use family planning methods are two different things. Same communication doesn't work there. Both have to be assessed separately. So communication, etc., have to be assessed contextually. नॉट इन जनरल कि 25 हॉर्स की स्टेशन थे उसमें एक स्टेशन कम्युनिकेशन का बना दिया, चलो मदर को समझाओ, ओके दैट यू असेस. बट व्हाट अबाउट 25 अदर स्टेशन? वहां पे तो कम्युनिकेशन नहीं हमने असेस किया. एंड वी सेड अर्लियर दैट कॉम्पिटेंसी इज रिवील्ड ओनली इन परफॉर्मेंस. And performance can be tested like a race बिल्कुल प्रिसाइज 0.01 सेकेंड वाली, या लाइक जिम्नास्टिक। आफ्टर जिम्नास्टिक के लिए तो हमारे पास कोई स्केल नहीं होता, पर फिर भी पूरी दुनिया मानती है उसको, गोल्ड मेडल्स मिलते हैं, ओलंपिक्स में जाते हैं। सो इट्स नॉट दैट सब्जेक्टिवली थिंग्स कैन नॉट बी असेस्ड, लॉट ऑफ थिंग्स आर एक्चुअली बीइंग असेस्ड सब्जेक्टिवली। इंटरेस्टिंगली, हमारी जो प्राइमिंग होती है ह्यूमन बीइंग की, वो पहले सब्जेक्टिव की होती है। आप किसी भी चीज को देखते हो तो पहले आपके दिमाग में क्या नंबर आते हैं कि सब्जेक्टिव आता है? सब्जेक्टिव आता है। सपोज मैं मार्केट में खड़ा हूँ, जस्ट लुकिंग एट पीपल, व्हाट कम टू माय माइंड? वो उसकी उसकी ड्रेस कितनी अच्छी है, उसकी पैंट नहीं मैच कर रही, उसका सूट तो बहुत अच्छा है, उसका ये ऐसे है, वो कितना लंबा है, वो कितना छोटा है। क्वालिटेटिव आता है। आई डोंट स्टैंड देयर एंड से 4, 6, 9, 8। एग्जाम में भी आपके दिमाग में पहले क्वालिटेटिव आता है, इसने बहुत अच्छा किया इसलिए मैं इसको 8 दूंगा। आप ऐसे नहीं करते हो, मैं इसको 8 दे रहा हूं इसलिए इसने बहुत अच्छा किया। सो द क्वालिटेटिव इज ऑलवेज द फर्स्ट। और लाइक आई सेड अर्लियर, जैसे एक्सपर्ट क्लिनिशियन पेशेंट अंदर आता है उसके कमरे में, और वो एक डायग्नोसिस उसके दिमाग में बन जाता है। द वे ही वॉक्स, द वे ही टॉक्स, द वे ही प्रेजेंट्स। ऐसे ही एक एक्सपर्ट एग्जामिनर भी स्टूडेंट के इनिशियल इंटरेक्शन से ही कैन मेक ए डायग्नोसिस ऑफ द स्टूडेंट। विल एलोबरेट बिट मोर ऑन दिस पार्ट। अब इशू ये है कि जो भी असेसमेंट मेथड्स हैं वो सारे के सारे साइकोमेट्रिशियंस ने डेवलप करे। नीट में 23 लाख बच्चे इस साल अपेयर हुए, 23-24 लाख, और 200 क्वेश्चन वो यूज करते हैं। हम अपने क्लासरूम में कितने यूज करते हैं? 10 क्वेश्चन, 15 क्वेश्चन, 20 क्वेश्चन, मैक्सिमम 20। कितने बच्चे होते हैं? 150, 200, बड़ी हद। मोस्ट ऑफ द कॉलेजेस विल बी स्टक विद 100। और फिर उनके वो सब ग्रुप्स कर देते हैं, वो ए और बी और कंट्रोल और एक्सपेरिमेंटल, और वो छोटे छोटे हो जाते हैं। तो जो स्टैटिस्टिक्स और जो स्टैटिस्टिकल एजम्पशन 25 लाख पे लगते हैं, वो 25 स्टूडेंट पे नहीं लग सकते। एंड ऑल्दो आई गेट मेनी पेपर्स फॉर रिव्यू, एंड ऑथर्स दे क्लेम हमारी रिलायबिलिटी 0.8 है, बट आई नो इट्स अ होक्स। It's extremely difficult to reach those high figures with only 50 students or 50 questions. It's not possible. और जो इमर्जिंग टेक्नोलॉजीज हैं, लाइक एमसीक्यूज एंड ऑस्की, पहले फेज के थे। तो मिनी सी एक्स और पी मैक्स और मल्टीसोर्स फीडबैक वो दूसरे फेज के थे। तो जो दूसरी फेज वाली टेक्नोलॉजीज हैं वो अनस्ट्रक्चर्ड हैं, लेस स्टैंडर्डाइज्ड हैं, हेट्रोजेनस हैं, नॉइजी हैं। नॉइजी मतलब एक असली होता है, और प्लस वो लॉट ऑफ यू नो थिंग्स कम विच डिस्टॉर्ट, विच आर लाइकली टू डिस्टॉर्ट योर जजमेंट। दिस आई हैव ऑलरेडी elaborated that as you keep on moving from knowledge to behavior, your assessment methods have to change. And I also told you last time that the tools that you use for one level are not applicable for the higher level, and vice versa. So if you have to look at competence, you have to look at performance. And that performance happens only at the topmost level. Or to some extent, maybe in the shows. Now, interestingly, what is objectivity? मुझे 61 की डेफिनेशन है जो आज तक चेंज नहीं हुई। इट सेज जजमेंट विदाउट potential interference of personal opinion, preference, mode of observation, views, interest and sentiments. अब इस डेफिनेशन पे कौन सी चीज फिट होती है? एमसीक्यूज फिट होते हैं इसमें? ऑस्की फिट होता है इसमें? ऑब्जेक्टिविटी की इस डेफिनेशन पे कोई असेसमेंट मेथड फिट नहीं है। हम आगे तो चलो जाएंगे, बट यहाँ पे आई ऑफन आस्क दैट क्वेश्चन कि अगर ऑब्जेक्टिविटी इतनी वो होती, तो फिर जितने एंट्रेंस एग्जाम इंडिया में हुआ करते थे सब में सेम क्वेश्चन आने चाहिए थे। जब मल्टीपल पीपीजी एंट्रेंस एग्जाम होते थे तो सब में सेम क्वेश्चन आने चाहिए थे, पर सेम तो नहीं आते। फिर जो मेरिट लिस्ट बनती थी भी सेम होनी चाहिए थी, पर वो भी नहीं होता। वो एम्स में बच्चा सेलेक्ट हो जाता था, पंजाब में रिजेक्ट हो जाता था, एंड वाइस वर्सा। एमसीक्यू जो एपिटोम है ऑब्जेक्टिविटी का, उससे ज्यादा ऑब्जेक्टिव तो आज तक कुछ नहीं बना था। पर इवन एमसीक्यू में ये सारी चीजें सब्जेक्टिव है। ब्लू प्रिंटिंग आप डिसाइड करते हो इम्पोर्टेंस कितनी है, और उसकी प्रिवेंटिव एबिलिटी कितनी है, और कम्युनिटी की उसकी प्रेवलेंस कितनी है, आप डिसाइड करते हो। एंड दैट में बी वेरी डिफरेंट बिटवीन टू टीचर्स ऑफ द सेम सब्जेक्ट। कंटेंट क्या होना चाहिए, स्टेम क्या पूछे, बिकॉज द वे यू आस्क मेक्स a लॉट ऑफ डिफरेंस। डिस्ट्रैक्टर्स क्या होने चाहिए, एंड स्टैंडर्ड सेटिंग। कहाँ पे बोलेंगे पास है, हम तो वो 50% में सबको धक देते हैं ना, पर एक्चुअली तो नहीं है वो तरीका। यू हैव टू सेट ए स्टैंडर्ड। और एमसीक्यू जब आप यूज करते हो, योर स्टैंडर्ड हैज टू कम समवेयर अराउंड 75-80. So none of the methods that we actually are using are objective. Most of these methods have a variable degree of human intervention in one form or the other. And we discussed that sample size makes a lot of difference. Raters, you have examiners from PGI versus you have examiners from Chintapurni. It will make a difference, even with an OSCE. And context, you are giving something which is applicable only to your institution, or you are giving something which is happening at a primary health center, or something which is happening at a referral institute. That all makes a difference. Now we know about a true score and a error score. So the total score of a person is actually a sum of true score and error score. And we believed that for each learner, a true score exists, which we have to find out. परफॉर्मेंस का तो पता नहीं, पर नॉलेज के बारे में तो हम ये मान के ही चलते थे, ये ट्रू स्कोर उसका होता है। और मोस्ट मेनी ऑफ यू माइट हैव गॉन टू दोज मीटिंग्स, डेल्फी कर लो, 4 ऑप्शंस हैं, डिस्कस कर लेते हैं 4 में से कौन से 3 यहाँ पे फिट होने चाहिए। तो वो आमतौर पे उनकी करेक्टनेस पे नहीं डिसाइड होता, वो डिसाइड होता है सीनियर कौन है, वो इतने टेबल टेबल कौन ठोक रहा है, कौन जोर से चिल्ला रहा है, कौन मैं जा रहा हूँ मेरी बात नहीं मानोगे। दैट्स हाउ थिंग्स गेट डिसाइडेड। तो वो शेयर्ड सब्जेक्टिविटी ठीक है, तो ठीक है यार तूने ये रखना चाहते, बट इट्स नॉट ऑब्जेक्टिविटी। एंड मोस्ट ऑफ द टाइम्स एग्जाम में भी जब पूछते हो हाँ जी कैसे किया बताओ, हाँ जी कैसे किया बताओ, तो दैट्स नॉट ऑब्जेक्टिविटी, दैट्स ओनली ए शेयर्ड सब्जेक्टिविटी which is very different from objectivity. Okay. This I already told you. अब इसमें what is more important is to look at the actions that we take. हम डिसाइड सब्जेक्टिवली करते हैं, उसको असेस ऑब्जेक्टिवली करने की कोशिश करते हैं। एक्चुअली क्या होना चाहिए, अब डिसाइड ऑब्जेक्टिवली करो, असेस चाहे सब्जेक्टिवली करो। इट्स लाइक डिसीजन मेकिंग।
सर ये समझ नहीं लगा।
एनी ऑर्गेनाइजेशन डेमोक्रेटिकली डिसीजन लेना चाहिए, सबसे पूछ के क्या करना है, कैसे करना है, क्यों करना है, क्यों नहीं। और जब इम्प्लीमेंटेशन का टाइम आता है तब डिक्टेटोरियल होना चाहिए। एग्री, डेमोक्रेसी की बात कर रहे हैं ना। हाँ, तो हम कोई क्राइटेरिया तो आप बना सकते हो ना, कि आप जब सबसे पूछ रहे हो तो आपको जस्टिफाई भी तो करना पड़ेगा ना अपना व्यू पॉइंट, कि हम क्यों ऐसा आप कह रहे हो।
सर
पर
नहीं
एक्चुअली
पता
क्या
लग
होता
रहा।
है कि डिसीजन हम डिक्टेटोरियली ले लेते हैं, अपने कमरे में बैठ के बॉस, वीसी, प्रिंसिपल, डायरेक्टर जो भी है, वो अपने कमरे में बैठ के डिसीजन ले लेता है। उसके बाद जो इम्प्लीमेंटेशन होता है वो डेमोक्रेटिक होता है, कि भाई कर लो तो अच्छा, ना करो तो और अच्छा है। आप देख लो सारे जितने एमएनसी वाले हैं वो सारे ही ऐसे हैं, करो तो अच्छा है, नहीं करोगे तो और अच्छा है। कोई बात, बिकॉज द प्रोसेस विच इज फॉलोड इज एक्चुअली फ्लॉड। हाँ साइबर, यू वांटेड टू से समथिंग।
सर कोई एग्जाम्पल, मतलब कोई मेडिकल रिलेटेड एग्जाम्पल बताओ, नहीं पता लगा ये कॉन्सेप्ट नहीं समझ लगा।
ये सुनाई नहीं दे रहा मुझे, क्या बोल रही थी? कि मेडिकल
सर
रिलेटेड
ये
एग्जांपल
वाला
बताओ, ये समझ नहीं लगा। से ये समझ नहीं लेना कि आप डिसाइड ऑब्जेक्टिवली, इम्प्लीमेंट सब्जेक्टिवली, ये पॉइंट। वही
सर
सीधी सी
मतलब
बात यही कर लो कि आपने ये डिसाइड किया कि कल से हर कोई 9 बजे आएगा, आपने नोटिस निकाल दिया एवरीबडी शुड बी इन ऑफिस बाय 9। पर इम्प्लीमेंटेशन का जब टाइम आता है तो फिर अगर से कोई नहीं 5 मिनट लेट आया, कोई नहीं 10 मिनट लेट आया, वो दैट हैपेंस डेमोक्रेटिक इम्प्लीमेंटेशन, वेयर एज यू शुड हैव आस्क्ड एवरीबडी, ओके व्हाट टाइम, एवरीबडी सेड गिव अस 10 मिनट्स, leverage this side that side, okay fine, by 9:15 everybody should be there, now you are dictatorial. Same way here, when I talk of medical issues, you know, what is the pass percentage, अटेंडेंस कितनी होनी चाहिए स्टूडेंट की, डिसाइड हमने कर ली 75 होने चाहिए, तो 65 पे चल कोई ना, दे देते हैं, बिठा दो। सो दैट इज वेयर देयर इज अ डिस्क्रिपेंसी, एंड उसको नॉर्मन कॉल्स objectivized, not objective. Objectivized means you are deciding subjectively, trying to measure objectively, is objectivized. And these objectivized methods do not give better reliability. I have listed only 3 references, but you Google subjective assessment and competency based, you'll get thousands of references. They represent only an arbitrary norm. मेरे हिसाब से स्टूडेंट को ये कर लेना, ये कर लिया ना, चलो पास। And therefore, assessments can never be completely objective. They'll always be influenced by the belief, thought, process of examination, institution, and so on. Entrance exam ही देख लो, एम्स का entrance exam will focus more on recent advances and high tech and molecular biology and so on. तो वर्धा वाले के चले जाओ तो वो गांधी जी के बारे में पूछते हैं, because their institutional philosophy is like that. Same happens with examiners. Some examiners will say कि नहीं देखो, ये बच्चा जो है ये जब फील्ड में जाएगा तब ये काम कर पाएगा कि नहीं, बट देयर आर अदर्स हु विल से ये नीट में या यूएसएमएलए में आंसर कर पाएगा कि नहीं। सो देयर ऑलवेज बी अ डिफरेंस ऑफ पर्सपेक्टिव between examiners and institutions and so many other factors, and therefore complete objectivity generally is not attainable. Many of you must have seen this table already, and you have not seen. Okay, can you interpret this table? So what you notice is there are different methods of assessment. And department or examinations or screening sets. These all are assessment in different techniques. What I want you to see is कि OSCE की reliability है 0.47, जबकि वो ऑब्जेक्टिव स्ट्रक्चर्ड है, और लॉन्ग केस की रिलायबिलिटी है 0.6, जबकि वो सब्जेक्टिव है। मिनी सीएक्स जो उससे भी ज्यादा सब्जेक्टिव है, उसकी रिलायबिलिटी है 0.73। शॉक इधर लगेगा। एमसीक्यू इज नॉलेज बेस्ड। हाँ, शॉक इधर लगेगा, एमसीक्यू की 0.62 है, पर जो एसए है, लॉन्ग आंसर जो हम यूज करते हैं, उसकी है 0.68। एमसीक्यू से ज्यादा होगी दोनों। तो चाहे नॉलेज है, चाहे प्रैक्टिकल है, द रिलायबिलिटी ऑफ subjective methods is actually more. And can you make a guess why is it more? Vast knowledge. Area will be vast.
Sometimes the objective ones are not answered based on knowledge, they are answered based on test wiseness.
Which of three actually? Two, three, those three. यार माइक में कुछ इशू है, आई एम नॉट एबल टू। रोजी है?
Hello, yes sir. Good morning. Sir, am I audible?
नहीं, you are audible, but I can't decipher it because
Fair test on the test wiseness of the person.
I was saying, sir, the objective, sometimes the formats are answered based on test wiseness and not basically knowledge or competency. So the reproducibility of the results will vary.
I would like you to look at the timings of these studies. So they were at a time when actually competencies, etc., were not in vogue. At that time, we were probably not talking of competency-based education. We're talking of a general medical education. And if you recognize these names, then you would find that these represent some of the who's who in assessment and medical education from across the world. So it's not that, it's just anybody doing a study, but it's really experts who have found this out. What happens with the essay type question is, or what happens with case presentation is, that you focus on multiple things. You are focusing on history taking, examination, making a diagnosis, explaining to the patient. Although you may not put it, but subconsciously you are also looking at communication, you are looking at ethics, you are looking at professionalism and so on. OSCE mein, you are focused only on one small point, palpate the abdomen, that's it. Yeah, elicit knee jerk. So the task, the relation of the assessment task to what the student is actually going to do in life is much more with subjective methods. And for this
Sir,
reason,
oral exam का भी reliability is more than OSCE here.
इसकी
Oral examinations reliability is more than OSCE.
चलो, oral examination is not really a assessment of practical skill. Oral exam is more of a theory. So I would compare oral exam with maybe MCQs or patient management problems. बुला के थोड़े माइक ही ठीक किया, नहीं चला गया वो। चलो, anyway. But the interesting part is yet to come, and that is,
If you increase the number of times,
if you increase the testing time, reliability keeps on increasing, and at 8 hours of testing time, reliability of almost everything is similar. Slight differences here and there, but otherwise, 8 hours of testing time, the reliability is almost similar for all types of assessments. And
most important thing is the time. How much time we are spending, Yes.
और टाइम का मतलब ये नहीं है कि वो बैठ के आप 15 मिनट टेस्ट लिया और 1 घंटा उसने चाय पी. When you say time, that means the tasks that you give increase. And when I say 8 hours, that's another important point. Please keep that in mind. When I say 8 hours, I'm not saying 8 hours at a stretch. Many a times, the issue gets struck, 8 hours का exam कैसे लेंगे? So 8 hours is total assessment. So even if you are taking 4 assessments of 2 hours each, or 8 assessments of 1 hour each, it's 8 hours.
It's multiple assessments like OSCE or long case, but total of 8. So we say the multiple assessment.
So like, for example, you are doing a formative, you are taking multiple assessments. And that is the reason the reliability of formative comes more than that of summative, because summative is only 3 hours, formative adds up to maybe 25, 30, 40 hours. Obviously, that is the only difference. When I say more time, that means more content. More content. Or now we know that whatever benefits of OSCE are there are largely due to content coverage rather than due to objectivity. So just one MCQ test at the end of 5 years may not be reliable. Sometimes when you use a wrong checklist or a wrong key, you'll be very objective. Everybody will mark it the same way, but it won't be reliable because you're getting a wrong information. You may have a highly consistent examiner. When they go decide करके जाते हैं अपन ने 5 ही देने हैं या 6 ही देने हैं, वो जो मर्जी बोले जो मर्जी ना बोले सबको 6 देंगे. So consistent तो हो गए but reliable तो नहीं बने. We have seen this. Reliability of OSCE is less than reliability of long case. Reliability of mini CX is more than OSCE. And so, what most people would agree is that reliability is not a function of objectivity. Reliability is a function of testing time. Or please keep that difference in mind. Whatever I am talking in terms of assessment in the classroom. I'm not talking of NEET. So don't go back with the idea कि NEET बेकार है because वो objective है. Because उसका sample size, उसके questions, that's a totally different logistics. But when you try to apply the same things to your classroom assessment, then whole lot of issues arise. And now actually with formative assessment not being added to summative or internal assessment not being added to the final marks, actually this gives you a very big opportunity to use a lot of subjective methods, direct observation methods, which till now we were not able to use because students would say uske number kam kar diye, mere zyada kar diye. But now that kind of a thing doesn't actually happen. Sampling is one of the methods to improve reliability. So blueprinting, if you do, some of the big shots, like I happened to go to KGMU for some talk, and the vice chancellor was very clear. He says, if you ask me one thing which will improve the quality, is blueprinting. Maybe he was overdoing it, but blueprinting, yes, definitely it helps. Then global ratings. जब स्टूडेंट आपके क्लास में होते हैं और एग्जाम देने जा रहे होते हैं फाइनल का, हम सब उनके बारे में एक इम्प्रेशन हमने बनाया होता है, ये बहुत अच्छा है, ये पास हो जाएगा, बहुत अच्छा नहीं है पास हो जाएगा, ये मुश्किल है और ये डिस्टिंक्शन लेके आएगा. आप कभी गलत साबित हुए? नहीं होते. हम गलत साबित नहीं होते. मोस्ट ऑफ द टाइम्स यू आर राइट. फर्क सिर्फ इतना हो सकता है कि आप 80 सोच रहे होते हो, वो 75 ले आता है, इतना फर्क हो सकता है. या आपका कलीग कहता है चल 75 तो नहीं, 70 तक तो आ ही जाएंगे, बट आप गलत साबित नहीं होते. और वो क्यों होता है? बिकॉज दिस ओपिनियन यू हैव फॉर्म्ड by observing the student over a long period of time. Long period. जब स्टूडेंट डे 1 पे आते हैं उस दिन नहीं आप ओपिनियन फॉर्म कर लेते हो ये तो बड़ा अच्छा है, ये तो डिस्टिंक्शन लाएगा. दैट डे यू डोंट से दैट. व्हेन यू से दैट, व्हेन यू हैव सीन देम फॉर 6 months, 8 months, 9 months, हर चीज में आपने परफॉर्मेंस देखी है, सेमिनार में देखी है, सिंपोजियम में देखी है, क्लास टेस्ट में देखी है, प्रैक्टिकल्स में देखी है, देन यू मेक ए ओपिनियन इसको मिले. तो ये ग्लोबल रेटिंग्स जो होती हैं दे ऑलवेज बेटर प्रेडिक्टर ऑफ एक्सपर्टीज, और दे मे हैव low inter-rater. You and I may not agree on the same marks, but ओवरऑल इन द सेंस कि जो होता है ना कि वो केस भी अच्छा कर रहा है, वो हिस्ट्री भी अच्छी ले रहा है, ये सारी चीजें आर मोर कंसिस्टेंट विद ग्लोबल रेटिंग्स. So educational impact, and again multiple studies to show that when students have to appear for essay type questions, they work hard for comprehension. And when students have to appear or prepare for a multiple choice test, they look for the E. बस ये याद कर लो, इसमें ए लगना है कि सी लगना है. ए में क्या लिखा है पता नहीं, सी में क्या लिखा है पता नहीं. Another study which says कि स्टूडेंट्स को चेकलिस्ट उन्होंने दे दी या ज्यादा प्रैक्टिस दे दी, दोनों के रिजल्ट्स तो सेम ही आते हैं. And we introduced OSCE in CMC in 1992-93. Pretty long time. And I can tell you from my experience कि आप अपनी चेकलिस्ट को सीक्रेट नहीं रख सकते, जितनी मर्जी कोशिश करो, वो लीक हो जाएंगी. और जब वो लीक हो जाएंगी तो वो स्टूडेंट सिर्फ चेकलिस्ट याद करते हैं, दे डोंट फोकस ऑन द प्रोसीजर. आई यूज्ड टू सेट पीजी एंट्रेंस एग्जाम, जब हम अपना लिया करते थे तो उसके लिए ऑस्की सेट करनी होती थी. एंड यू नो मेरे पीछे लगे होते थे बच्चे कि मैं कहाँ जाता हूँ, कौन से डिपार्टमेंट में जाता हूँ, क्या लेके आता हूँ. So once I went to radiology and requested them for some X-ray. तो उन्होंने मेरे को वो दे दिया, एब्सेंस ऑफ स्कैपुला का कोई एक्सरे. ले आया मैं. बाद में मुझे लगा कि थोड़ा ज्यादा कॉम्प्लिकेटेड हो जाएगा एमबीबीएस वालों के लिए, शुड प्लेन चेस्ट एक्सरे. तो वी केप्ट ए प्लेन चेस्ट एक्सरे. But would you believe every student wrote absence of scapula? क्योंकि उनको पता था कि मैं वहां से वो एक्सरे उठा के आया. The point I am making is कि they will always devise ways and means to find the answer, not the procedure. Now, when I say subjective, then don't go with the idea that all subjectives are there. May not be. Actually, it depends on expertise. It's just like an expert clinician. मेरे ओपीडी में बच्चा एंटर करता है तो देख के मैं रीजनेबली श्योर कह सकता हूँ कि ये तो यार मंगोल दिख रहा है, डाउन सिंड्रोम दिख रहा है, या ये तो हाइपोथायराइड दिख रहा है. रेजिडेंट फॉर एग्जांपल में से कुछ ठीक नहीं लग रहा, पर क्या मेरे को पता नहीं. सो एक्सपर्टीज मेक्स ए डिफरेंस. सेम इज विद एग्जामिनर्स. सो एग्जामिनर एक्सपर्टीज मेक्स ए लॉट ऑफ डिफरेंस. एंड देन इट रिक्वायर्स ए prolonged close observation in a climate of trust. That is the key word. अगर ट्रस्ट नहीं है, क्योंकि ना ऑब्जेक्टिविटी इंट्रोड्यूस हम तभी करी जब ट्रस्ट खत्म हो रहा. When students started believing that teachers are biased, that is the time objectivity came in. So if trust is not there, then subjectivity will not work. Or Cassidy actually has given a good name, that is valid subjectivity, which requires substantiated rather than unconfirmed opinion. Now you can increase reliability even with subjective assessments. See, just community medicine people will tell you, if you have a lot of variability, there can be two methods. One, so you remove those outliers, that is one, and second, you increase your sample size. So choice of test should be decided by purpose of assessment rather than and unconditional appeal to objectivity. जब ये उसकी नया नया शुरू हुआ था तब ये एमईयू इंडिया ग्रुप पे बड़ी मेल्स आती थी. आई एम फ्रॉम माइक्रोबायोलॉजी, टेल मी वेयर शुड आई यूज ऑस्की. नो, दैट्स अ वेरी रॉन्ग वे ऑफ डूइंग, यू नो. इट शुड नॉट बी मैं ऑस्की कहाँ लगाऊं, इट शुड बी अदर वे राउंड कि ये टेस्ट करने के लिए कौन सा टूल यूज करूं. एंड एज आई कॉमनली से, यू नो, कोड सी के डिसाइड करते हो कि बटन कौन सा लगेगा. उल्टा नहीं करते हो कि बटन ले आए हैं अब सोचेंगे इस पे कोड कौन सा लगाएं. And be aware of the limitations. You know, all assessment methods have some strengths, some weaknesses. So be aware of the limitations of the methods. And then you have to improve the trustworthiness because बिना ट्रस्ट के सब्जेक्टिविटी नहीं हो सकती. हर कोई डाउट करेगा, आपके स्टूडेंट्स डाउट करेंगे, पेरेंट्स डाउट करेंगे, आपका इंस्टीट्यूट एचओडी डाउट करेगा, आपका प्रिंसिपल डाउट करेगा, आपका वीसी डाउट करेगा. सब्जेक्टिव ले लिया. अरे, so there are some methods. So training is of course the first. Examiner training. Use multiple sources of assessment. तो वो वन टूल वन कॉम्पिटेंसी वाली मॉडल से शिफ्ट ओवर टू मल्टीपल टूल्स वन कॉम्पिटेंसी. तो नॉलेज के लिए सिर्फ एमसीक्यू पे मत जाओ, यूज अदर मेथड्स आल्सो. देन ब्रॉड सैम्पलिंग. और ब्रॉड सैम्पलिंग एक्चुअली हर चीज में आ जाता है. Whether you want to improve the transferability of your results or whether you want to improve the dependability, sample size is a must. 4 क्वेश्चन ले लिए, 5 क्वेश्चन उठा लिए, that is just making a mockery. No, I'm not making a plea to discard objectivity. You know, it has its place. Same way as subjectivity has its place. So not that you discard objectivity, bring all subjectivity. The choice should be guided by the purpose of assessment. If I have to assess ethics, SDL, lifelong learning, leadership, I cannot use objective methods. And if I try to use, it will be all hoax. On the other hand, if I have to use knowledge, assess knowledge, then I cannot say I'll use subjective methods. Use objective methods. And subjective assessment actually requires subject expertise, long-term observation, trust, and reciprocity. But for competency-based assessment, most of your assessments, especially at the classroom and institutional level, should be subjective. Because you have to generate a lot of feedback. And that feedback doesn't come from objective methods. So what does it mean for the end user? The degree of confidence that you can place in the student. And you might have heard this example earlier also. Venugopal, who was the first cardiac transplant surgeon, he himself required a coronary angioplasty. He could have gone anywhere in the world, you know, he was so well known. People would have been happy to operate on him. But he insisted that his student operates on him. That is reliability. How many of us are willing to be treated by our students? No one. So you have a choice. Precisely measuring limited knowledge or unprecisely measuring vital knowledge. You decide. And does it make a difference? It will. Because you don't have to base educational decisions on single measurement. And Norsini was actually a step ahead. He says single measurement, howsoever well done and well planned, are always flawed. And you have to reduce dependence on government examinations. For competencies, your major focus should be on formative, ongoing, internal. बाई डेफिनेशन कॉम्पिटेंसी इज हैबिचुअल एंड जुडिशियस। वो हैबिचुअल वहां पे आधे घंटे में नहीं असेस हो सकता, वो हैबिचुअल के लिए आपको लॉन्ग टर्म ही करना पड़ेगा। सो व्हाट हेल्प्स? वाइड सैम्पलिंग, across content setting assessors, and sampling is much more an issue than objectivity or subjectivity. Holistic judgments, rather than making checklists smaller and smaller, just overall you say clinical approach is अच्छी थी, that works well. And in training assessment is actually the way. National education policy, it emphasizes bringing down the assessment to ongoing process. It doesn't emphasize term and examination. Schools में देखो, they have actually cut down a lot of dependence on term and examination. Most of it is on the ongoing assessments. And when we say assessment drive learning, then summative assessments are actually poor feedback carriers. You can't generate good quality feedback on summative assessment because the purpose is different. अब आप फाइनल प्रॉफ एग्जाम में नहीं स्टूडेंट को पकड़ के बैठ सकते कि आजा तेरे को फीडबैक दूं, बट यू कैन इजीली डू दैट इन योर classroom assessments. Same way, formative assessments alone may not be very lasting. So you mix up the functions. Same assessment serves as formative, same serves as summative. Like NEP, they say, have multiple assessments, and in the end, you combine them and make a decision. Suppose you have a jar full of balls like this. Now you can have multiple questions when you have a jar like this. Are there colored marbles in the jar? How many scoops you need to take? One. Just one might be enough. कलर दिख गया जहाँ पे वहां का काम खत्म। कोई बात नहीं, हमारा क्वेश्चन तो यही है ना कि आर देयर कलर्ड मार्बल्स। विच की बातें नहीं कर रहे, हम तो ये कह रहे हैं कि आर देयर कलर्ड मार्बल्स। एक स्कूप निकालो, एक भी कलर फर्क दिख गया तो योर आंसर इज यस एंड फिनिश, उसके आगे कुछ नहीं करना। बट इफ योर क्वेश्चन इज आर देयर रेड मार्बल्स इन द जार, then probably you have to have more sampling, because one scoop may not give you red marbles. It might come out with blue or green or something. Red हो सकता है नीचे हो। और अगर आपका क्वेश्चन है but proportion is red,
everything has
आपका
to be
sample size हो जाएगा। So depending on what kind of assessment you are doing, your sample size increases or decreases. So for summative, you have to have a very big sample size. And when I say big sample size, it does not mean that everything has to be assessed on that one day. So that is the reason you say combine the formative and summative functions. Must have seen this movie, Dil Mange More. So when you are actually planning assessment, you have to do the same thing. More assessment, more context, more competencies, more occasions, more examiners, more tools. Okay, open for questions.
बात बिल्कुल सही है। More sample size will definitely give more result, more timing will give more result. But वही है कि practically इसको implement नहीं कर पा रहे हैं।
हाँ, वो इसलिए क्योंकि हम जब भी असेसमेंट कहते हैं, हमारे माइंड में सिर्फ एक फॉर्मल असेसमेंट आता है। जब हमने सारे स्टूडेंट को क्लास में बिठा के एक क्वेश्चन पेपर दिया और उन्होंने लिखा, वो असेसमेंट था। बट दैट इज नॉट द केस। डे टू डे बेसिस पे भी तो आप असेस कर सकते हो, जब वो केस प्रेजेंट कर रहा है, जब वो हिस्ट्री ले रहा है, जब वो सेमिनार प्रेजेंट कर रहा है। दिस आर ऑल ओकेजन्स, जिनको हम टेस्टेबल मोमेंट्स कहते हैं। तो टीचिंग लर्निंग में बहुत सारे टेस्टेबल मोमेंट्स आते हैं जिनको हम इग्नोर कर जाते हैं, जिन पे हम ध्यान नहीं देते. सो आइडेंटिफाई दोस टेस्टेबल मोमेंट. इवन आप जब कैंटीन में बैठ के चाय पी रहे हो राउंड्स के बाद में, इवन दैट इज एक्चुअली अ टेस्टेबल मोमेंट. व्हेन यू आस्क अच्छा वो हमने उसको ऑपरेट तो कर दिया, व्हाट डू यू थिंक क्या निकलेगा उसकी बायोप्सी में? तो असेसमेंट तो हो गया ना वहाँ पे. So assessments don't have to be formal. A lot of informal assessments can be done. And that is the reason formative have a better reliability because number is more, contexts are better. Summative में अगर आप उसको रिटर्न बोलोगे तो वो बोलेगा जो किताब में लिखा है. जब फॉर्मेटिव में आप बायोप्सी के बारे में पूछोगे तब वो बताएगा जो वो देख रहा है और समझ रहा है. That is the difference. Any comments from?
So, am I audible?
हाँ थोड़ी जोर से बोल.
Sir, based
हाँ.
on this, how do we justify the role of external evaluators in summative examination? And if yes, then what should be the weightage of internal and external evaluators?
एक just 1 minute रुझे, I'll answer you. Go ahead.
But the external and internal evaluators का concept तो summative में आता है ना.
Summative
Sushant
only,
ji,
I'm asking what is
give me
how
1
do we
minute.
just, yeah.
Give me 1 minute. ये अभी Ruzi, what you said, you asked about the
So in summative
proportion of.
examination, yeah. Is it justified first to have external evaluators, or if we actually build the confidence and trust, the internals can actually do the summative themselves? And if still externals are required, should they have equal weightage in assessment?
देखो, if you look at the status prevalent around us, then except for few neighboring countries like Pakistan and Sri Lanka and others, in rest of the world, there is no summative assessment. Most of it is decided on formative, and then there is a licensing exam to maintain quality. So you can gather more information about the student by formative assessment rather than going for summative. Does that answer your question?
He asked about examples.
Yes, sir.
That do we need to have external examiners for summative assessment? If yes, then what will be the weightage?
और एक्चुअली अगर आप एक्सटर्नल कर रहे हो तो मेरे हिसाब से सारे ही एक्सटर्नल होने चाहिए, लाइक द नेशनल बोर्ड पैटर्न. बिकॉज यू नो टू हैव टू इंटरनल्स हु आर सिटिंग देयर एंड सेइंग नहीं ये तो बड़ा अच्छा है, नहीं तो ये तो बड़ा अच्छा है, दैट डिफीट्स द होल पर्पस. So it should be a centralized system, you know, in every state. For example, you have a designated university or a institution where they go and appear for their exams. So it should be mostly by externals. Again, it will depend on what purpose you are using it for. But if you are using it as a quality assurance mechanism, then I personally would go only for external examiners rather than having a mix of internal and external.
But sir, issue will external examiner, they have not seen the student over the whole of the year. They are just coming on one day, and they may not even the student may not perform well on that particular day. So I think that's the role of internal examiner.
पर उसमें फिर वो ये होता है ना कि वो हर कोई बेचारा बन
Subjectivity.
जाता है ना, इसको ये प्रॉब्लम हो गई थी, उसको ये इशू था, वो उसको फैमिली प्रॉब्लम थी इसलिए वो पढ़ नहीं पाया. वैसे तो अच्छा है. You know, those
Subjectivity
kind
आ
of
जाता है
things
सर.
then actually distort your results. सुशांत, you were saying something.
No, subjectivity इसमें आ जाता है सर, बोल रहा था
यार
मैं.
ये उधरों आवाज नहीं आ रही.
हाँ, इसमें subjectivity आ जा रहा है सर. तो when we are adding internals,
With internals, subjectivity comes. You see.
लाइक नेशनल बोर्ड के भी तो एग्जाम होते ही हैं आफ्टर ऑल. सारे एक्सटर्नल होते हैं वहां पे, इंटरनल तो कोई भी नहीं होता.
That's why the pass percentage was very low. That was the difference.
हाँ, पर अगर आप तरीके से सोचो ना, तो जितना हम रिजल्ट दिखा देते हैं, वो उतने उतने पास होने लायक होते तो नहीं है। और क्योंकि हमारा बार हमने लो सेट कर रखा है, इसलिए स्टूडेंट्स भी उतना ही करते हैं। आप अपना बार हाई कर दो, दे वुड स्टार्ट लर्निंग, दे वुड स्टार्ट रीडिंग। भाई, हमारे ही यही स्टूडेंट जो यहाँ पे फेल हो रहे होते हैं, वहां यूएसएमएलई में जाके कैसे वो 99% ले आते हैं।
तो पता है ना, अभी वहां पे स्टैंडर्ड वो है।
Exactly.
Accordingly prepared that.
यहाँ पर बोलते कोई नहीं डरता।
I have seen one of our student, मतलब he was very ठीक था यहाँ पे, and suddenly I got message कि तो फिर मेरा MLE clear हो गया and I started residency. Yeah, good, very good. So I never expected.
Assessment right and पहले से था, अभी उतना ही नहीं है।
तो जब हमारे कंट्री में ऑस्की नहीं होती थी, तब भी तो वो ऑस्की कहीं से तो सीखते थे ना, कहीं से तो सीखते थे। वो सीख के वहां पे कितने ही बच्चे मैंने देखे हैं जो 99th परसेंटाइल वाले हुआ करते थे वहां। सेम वे यू अप्लाई समथिंग न्यू, दे वुड लर्न। अब हमारा आप अपना बार ही नीचे कर लो, नहीं बेचारा बच्चा, उसको टाइम नहीं है, उसको लोड पड़ रहा है, उसको ये, फिर वो भी वो ऐसे ही।
40% पास परसेंटेज हो गया है मतलब थ्योरी में। तो अभी स्टूडेंट पता क्या बोलते हैं कि सर थ्योरी में तो 40% लेने हैं, प्रैक्टिकल में ना हम 70 मतलब
ऐसे वही कर। So that is what is happening actually. So you bring it down, they will also bring down their thing. और ये एक्चुअली व्हेन आई वाज इन मास्ट्रिक्ट, दैट टाइम दे वर डूइंग ए स्टडी, और बड़ी इंटरेस्टिंग स्टडी थी। उनकी कोई अटेंडेंस की रिक्वायरमेंट नहीं थी, अनलाइक वी हैव 75 एट एरिया, कोई रिक्वायरमेंट नहीं, आपकी मर्जी है, आना है आओ, नहीं आना नहीं आओ। अंत में बस आप अगर उनका एग्जाम पास कर जाते हो, देन दैट इज गुड इनफ। और उस टाइम पे उनकी एवरेज अटेंडेंस 9500 हुआ करती थी। फिर एक दिन कोई आया, डीन, ये कहता है ये क्या अटेंडेंस नहीं है तुम्हारे पास में, नो यू शुड मेक ए क्राइटेरिया, दे हैव टू कम 75% ऑफ द टाइम। अगले महीने से वो ड्रॉप हो गए, 75 हो गई।
95
उनको 75 भी पूरे करने हैं गवर्नमेंट को।
कि वो जितनी हम रिस्ट्रिक्शन लगाते जाते हैं ना,
नहीं, आई एक्चुअली आई एम विटनेस टू दिस। मेरे घर में दो एमबीबीएस स्टूडेंट थे, तो उनके फ्रेंड्स आके बातें करते थे, तो मुझे भी कुछ कुछ सुनाई दे जाता था उसमें। तो वन फेलो वुड कम, ही वाज फ्रेंड ऑफ माय सन, एंड बड़ी कैलकुलेटेड उसकी होती थी। वहां देख, सर्जरी में 3 क्लास लगानी है, गायनी में 1 लगाऊंगा, मेडिसिन में 6 कर लूंगा, सब जगह 75 हो जाएगी, उसके बाद जाना बंद कर।
नहीं करते।
सो दे बिकम वेरी कैलकुलेटिव, कि क्या करना है। तो अटेंडेंस एक्चुअली बिकम्स ए फिगर टू बी अटेन्ड रादर देन टू लर्न समथिंग फ्रॉम देम। तो हम क्या बनाते हैं उस पर बहुत डिपेंड करना। ओके, थैंक यू सो मच। नेक्स्ट वीक विल
Thank you, sir.
लास्ट एंड नेक्स्ट।
थैंक यू सर।
Thank you, sir.
थैंक यू सर।
Meeting